From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning on this Saturday morning. I hope everyone's looking forward to a great Labor Day. I know my son cannot wait for tomorrow because of the NASCAR Darlington race coming up. And if Jeff Gordon wins, then that'll make it even a more special day. But I'm your host, Jeff Reed with Medical Forum. My co-host, Dr. Marr, is off on vacation. As we talk about when he is off on vacation, all kids stay in school, be a doctor, so you too can vacation as much as Dr. Marr does. But anyway, we'll miss him today. I do want to make a couple comments on last week's show with Jeff Fall and Kurt Ackerman. Go by and see them at the Industrial Medical Center there on 1215 Alice Drive. The phone number there is 774-8842. I think Kurt's service that they do, especially during this time of year with football, the Black and Blue Clinic is just a phenomenal way for kids that they can, rehab and get back on the field. And I think we learned a lot last week. Also, with the Toomey Foundation Golf Tournament coming up on October 9th, let's get out and support it. As we start, I want to thank, as always, our sponsor, At Your Service Home Care, your concierge steward guide to home care and beyond, located on 1250 Wilson Hall Road. Stop by or give them a call at 607-9677. And today, I have two good friends that are on the show that are going to talk to us about Clarendon Health Systems. And a lot of great things going on. I know that personally from hands-on experience over the last couple of years. And first person I want to introduce you to is Richard Stokes. Richard Stokes is the CEO of Clarendon. Jeff. Richard, how are we doing? I appreciate you coming out here. I know after a busy week and a busy schedule. But, what we try to do in the first element or the first segment here is just to kind of give a little background on yourself, Richard. So if you could, let us know some background on Richard Stokes so we can talk about all the duties you do after.
All right. Well, again, good morning, Jeff. Thank you for having us on the program this morning. I grew up in a little community called Ashwood between Bishopville and Sumter. I was actually born at Toomey way back in the day. Went on to college, graduated from USC with a degree in accounting, and spent the majority of my career in accounting as a CPA, and transitioned to healthcare and have worked as a CFO at several hospitals, a chief operating officer at Clarendon, and now as chief executive officer.
Right. Very good. And Katie Rabon, Dr. Katie Rabon, I think everyone knows Dr. Katie Rabon in Sumter.
Hi, Jeff. Thank you.
How are you doing?
Good.
And you are now the chief medical officer at Clarendon. So give us, for those that might not know, give us all your background, experience, and then what all you do there at Clarendon.
Great. I am a Sumter native and actually graduated from Converse College and went on to medical school at MUSC in Charleston, and then did my residency in internal medicine in Columbia at Palmetto Health Richland. After that, I have been a practicing hospitalist now, and for about 15, 16 years.
Correct.
And went to Manning about 4 years ago, and time flies, and started there as a hospitalist and the medical director of the hospitalist, and moved into the chief medical officer position about 2.5 years ago.
Very good, very good. Well, let's kind of acquaint everyone with Clarendon Memorial a little bit. 65 years. We're coming up on an anniversary here.
65 years.
In several communities, especially small hospitals. We know, with my acquaintance with medical equipment and obviously Dr. Mars with being a physician at Colonial, we've seen so many changes, and unfortunately not positive changes in the medical community, especially on reimbursement, level of paperwork and such. But hospitals your size in the rural community, we've seen a lot of them close.
Yeah, Jeff, that is something that is rampant in Georgia. We in South Carolina, we have multiple hospitals that are having some difficult times with the state not expanding Medicaid. It has definitely put a physical burden on all those small rural hospitals, and we're no exception to that.
I gotcha. Well, one thing I think is kind of nice about your hospital and vectoring through this, and maybe this helps you stay in business as well is that you bring in so many other services, and we'll talk about that as the show progresses. But you have 3 nursing homes that you're affiliated with? Is that correct?
We have 3 long-term care facilities that also provide rehab services in each of those facilities. So we did 240 beds.
240, and that's extended through the 3
different long-term care facilities.
I was looking at it. I think there's one with 66 beds, one with 88 beds.
The 288.
Yeah. And what are the names and where are those located for anybody listening out there? Because I know there are so many. We've had a lot of people on the show with nursing homes in different locations through Manning. Katie, there's 3, correct?
Right.
What's the first one?
Lake Moultrie is in St. Stephen's. It's an 88-bed facility. Lake Marion is in the town of Somerton, which is right outside of Manning, another 88-bed facility. And then Windsor Manor is the 3rd facility in Silver.
Well, you know what? I happen to, because I always research this so occasionally, I think it's probably more accurate. Located, for anyone listening in that wants some contact information on these fine facilities, Somerton, South Carolina, 803, I believe 485-2317, and that's your Lake Marion location.
Right.
88 beds. That's pretty good. That's pretty good size. All kinds of therapy, respite care, hospice care available. Then we have a 64-care facility, and I believe that one's, what's the name of that one?
Manor.
Windsor Manor. Yeah, I think Robin Alexander, give her a call. She'll give you the ins and out, but basically 64 skilled care beds, IV therapy, oxygen, wound, and rehabilitation therapy again. So I think what we've learned for the people listening on shows is that when people come, say, off of a rehab, and let's say they have Medicare, you've got 20 free days visits, or Medicare will pay for it, and then the other additional 80, especially if you have a second. So great place to go. Get your rehab done. It's not just for nursing facilities, but I think the fact that rehabilitation is such a vital part.
It is. Rehab is so critical to a patient quality of life as they continue to heal and move forward.
Well, this is beautiful. And I think we get the same physician every time.
Right.
Yes, you do.
There is a board-certified geriatrician that's the medical director of all 3 facilities, and that's Dr. Mays DeBose.
Yeah.
Also a Sumter native.
That's a coup.
It
That's
is.
a coup.
It
How'd
is.
y'all- He's as great. He's as good a physician as anyone that you could ask for dealing with geriatrics in particular.
Well, Mays helped save my dad's life, and so I think a lot of Dr. DeBose. He's a very good physician.
Very good.
Clinically excellent.
That goes beyond reproach. As we come up on our first break, we're with Richard Stokes, CEO of Clarendon Health Systems, and with Katie Rabon, Dr. Katie Rabon as well. And as we come up, want to thank all of our friends at Bynum Insurance. Stop by and see them as we get into that period of Obamacare and Affordable Care Act. Let them help you vector through that 469-3030, and we'll be back right after this.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
At Your Service Home Care provides in-home personal care, including light housekeeping, bathing and dressing assistance, medication reminders, meal preparation, companionship, transportation, and assorted other assistance to continue living safely and comfortably at home. At Your Service Home Care works with your local home health, hospice, Alzheimer's and VA programs, and other providers in the Sumter, Clarendon, Lee, and surrounding areas. Locally owned At Your Service Home Care is here to ensure you and your loved one continue to live your life with dignity and respect. At Your Service Home Care, 1250 Wilson Hall Road, Sumter, 803-607-9677. Please call, stop by the office, or visit www.ays-homecare.com and let them know how they may be of service to you and your loved one.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we are back on this Saturday morning, about 10 o'clock here, a little after 10. Also want to remind everyone that not only do we air on Saturday from 10 to 11, it re-airs on Sunday 2 to 3. So please join us as we are sitting here talking with Richard Stokes, Dr. Katie Rabon. We're finding out everything that we can in such a short time about Clarendon Health Systems. Richard, if you wanted to convey something to people that are listening out there, what would you want to convey about Clarendon?
Well, Jeff, as I think about Clarendon and our role and how we fit within the healthcare community in Sumter and Clarendon and Williamsburg County, we view ourselves as your out-of-town, hometown hospital. We have approximately 20% of the babies born at Clarendon Memorial come from outside of Clarendon County, and about 20% of the emergency room visits come from people into Clarendon County. So, I want people to understand that we view you as part of our extended family.
Mm-hmm. Well, that kind of, I've seen your slogan, the new slogan, care like never before. Is this kind of, Katie, where did that come from? Did you think it up, Katie?
I can't take credit for that one, actually. I think that was a Richard comment.
But I think that goes right in hands with what Richard was just talking about, correct?
It is. I've been there in my role for 2.5 years, we said earlier, and Richard's been the CEO for about the same time. And, as we're moving forward, we want to make sure, as a small community hospital, we're not going to be able to do everything, but what we do, we want to do well. And so we want to offer care like never before. And so as we're moving into what we consider our next steps, with healthcare, is trying to figure out where Clarendon fits, in the healthcare system. We have 2 board-certified cardiologists, Dr. Strat Stavro and Dr. John Rosich. Any kind of, healthcare needs related to the heart, they're there for you, whether it's high blood pressure, whether it's congestive heart failure, any kind of arrhythmias, vascular issues. So we're really excited about being able to provide that. We don't want people to have to leave the community if we can avoid it. We also have Dr. Devon Barano, a general surgeon. He's been there a little over a year now, and one of the services that he provides that has not been formally done at Clarendon is a video-assisted thoracoscopy, and bronchoscopy. So he did
can
some.
I ask you on that?
Sure.
Me being a layman in that, and most of our audiences, let's talk about that. That sounds like something that when you say no one has done it before at Clarendon, what is that?
Right. It's a procedure, and it can be done at other hospitals, but I had a surgeon that was specialized in that, and Dr. Barano did receive special training. But, if you have a nodule or a spot on the lung that someone saw and you may need some further testing, either bronchoscopy, where they put a light scope down and look inside depending on where the area is, or going through with a small incision and a video camera, to look and see if they can do a lung biopsy or a biopsy of the tissue surrounding the lung.
Are we looking for cancer there, or just don't know?
Cancer, infection, don't know what it is. Is it scar tissue, things like that. So, and then if we need to, then we can do a specialized area if it is cancer.
Well, maybe talk about that. I didn't realize that you have such a good relationship with Providence, or a formed relationship where, is that Richard?
Yeah, Jeff. We As Katie indicated, what we cannot do locally, we try to establish relationship with larger facilities that have the expanded expertise. So several years ago, we partnered with Providence Hospital for cardiovascular care. So once they come through our cardiology office, Dr. Stavro or Dr. Rosich, they will refer patients to Providence Hospital for further testing. Just coincidentally, patients that we refer for cath procedures at Providence, we are 10% below the national average for sending false positive patients through the cath lab. What that means is when we send you to Providence, you need to go to Providence.
Right. Right. This isn't just that you're just going, well, it might be. And I think that speaks into your technology because you're able to see and be able to detect accurately. Katie, what other we talked about with Providence? What other specialists have been brought in here? Probably in the last 2 years, probably since you two have come in. So we've talked about Dr. Stavro and the cardiovascular, and Dr. Barano, obviously with the surgic.
Right. Well, one other thing I'd like to mention with Dr. Barano, he's our medical director of our wound care center, which is new for Clarendon. We've had wound care, but we're really trying to increase our services in that area. And we also have a certified wound care nurse, Tommy Jean Alexander. So, that's something that we're really excited about, and all the new and different techniques for trying to heal a wound. And I'm sure with your experience with DME equipment and all, you know a lot about all of about everything that's coming in the future with that. We do, and to speak on Tommy Jean, we've worked with her at Reliable Medical for a long time, and so again, as you continue to bring these people in, the hospitals continued, as you say, care like never before. Let's talk about the wound center just a touch. Who qualifies for that? What type of patients do you generally see? When we see it as a referral from yourself or Tommy Jean in the past, is someone that maybe has had an artificial limb, who's had a leg amputated, and then we're looking at caring for that wound. As we know, predominantly diabetics are victimized by this, and then we have to be very, very careful when fitting that the limb. But what else? Who else would be interested in a wound? We get a lot of referrals from our primary care providers. As you said, diabetics that don't heal well, people that have lower extremity swelling, and they can have skin breakdown wounds. Anybody that has a poorly healing wound, there are a lot of new techniques out there, different sorts of what we call debriders, enzymatic debriders, different types of dressings that can be put on that they're well versed in. And so, and they'll, continue to follow you and get you back to your regular doctor, either once it's healed, or if there are some other issues going on. So that's something, I think that's going to be a very, very big thing for y'all. We talk about diabetes and stroke. I think the Sumter community is the number one per capita in the United States per stroke. So when we look at that, diabetes is not far behind. So as our baby boomers are getting a little older, 10,000 turn 65 every day, I think that's going to be something that's going to be well needed down there. And for anyone listening in just now and joining us, we have Richard Stokes, Dr. Katie Rabon here with Clarendon Health Systems. As we come up on our second break, I want to thank our sponsor, Medi Home Care, for home health, hospice needs, medical equipment needs. Check them out on 2560 Tahoe Drive. Give them a call at 905-7720. And we'll be back with Richard and Katie right after this.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
I was Daddy's girl. He was my guide, confidant, and friend. We cooked out, fished, and talked about everything. He has trouble remembering those times now. I'm the parent and caretaker to my dad. He does remember losing his dignity each time he needs my help with simple daily care. Calling At Your Service Home Care was the best thing I've ever done for my dad. His personal attendant provides assistance with bathing and dressing, a compassionate presence for his safety, and even travels with our family. Having At Your Service Home Care working with me now gives my dad his dignity, and I can enjoy just being his daughter again. The wonderful people with At Your Service Home Care have the gift of caring for your loved one. If you have become the caretaker to a parent like me, contact At Your Service Home Care, 803-607-9677. Located at 1250 Wilson Hall Road in Sumter, or visit the website www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
And we are back. And I'm your host, Jeff Reed. Absent today is my co-host, Chris Marr. He will be back with us next week, though, so never fear. We are here with our guest, Clarendon Health Systems CEO, Mr. Richard Stokes, and Dr. Katie Rabon. And when we last left, we were talking about all the changes in with Clarendon, including yourselves. I mean, 2.5 years is not that long ago when you were the new kids coming in to take over quite a lofty task. I mean, when you're a rural hospital in the first segment, just to keep things afloat is quite a credit to you. And now in the second segment, what we discussed for anyone just starting to hear the broadcast, we start talking about all the talent you've brought in. So, Katie, continue on with that. I think people want to know what services, and tell us about some of the people.
We've been really excited with our recruitment efforts, bringing in qualified physicians and nurse practitioners, midwives, as well as physician assistants. You know, we want to make sure that we provide quality care. And in order to do that, we know we've got to have the right people in place. We have Dr. Heischberger, Lisa Heischberger, who is a family practice physician. She started with us within the last month, and we're really excited about having her here. We also have a new pediatrician, Dr. Mildred Carson, who will be with us, and Dr. Larry Conley, an orthopedic surgeon. And Dr. Conley has been with us for a few months now and is doing a great job in the operating room. He does minimally invasive surgery with the knee, hip. So we're really, and then we also have our swing bed unit, which opened up within the last year.
When I talk to a swing bed, what is that? Is there something that maybe we could relate to, or is there another term? Swing bed unit simply means, and how does that differentiate from a normal bed that you have in your hospital?
Well, we have 16 certified beds for a swing bed, and that's where somebody maybe is not quite ready to go home from the acute side of the hospital.
Okay.
They've had a 3-day qualifying stay for most insurances, but yet they don't really want to go to a nursing home or a long-term care facility. And so they just need maybe an extra, week to 2 or 3 weeks to get strong enough to go home.
Okay.
So we do rehab with occupational therapy, speech therapy, physical therapy. In addition, it sometimes is not, that you've had a hip fracture and need to do rehab. It's that you're elderly, you have a lot of medical problems, and, just maybe having pneumonia in the hospital has weakened you so much that you're really not quite ready to get back to independent living. And you need that little bit of extra time, maybe some additional IV antibiotics. So it's just a sort of a transition.
I think that's a good word. Richard?
Yeah, the swing bed program, as Katie indicated, is really for the patient that, as she said, not quite ready to go home. So when we were thinking about, what services to expand into last year, our thought was that we had this patient population that couldn't go, but according to Medicare rules and Blue Cross rules, they weren't sick enough to stay in the hospital. So that's when we came up with, let's bring this intermediate care level of service to our community, and that's what we've done. And we've had a lot of success with patients coming out of our acute care into swing. We've had patients from MUSC, Palmetto, McLeod, all leave those hospitals and come into our swing bed program because just to tune them up before they get fully released back home.
That's people that have followed the show, we always talk about the 3-night stay. And I think you both have echoed that as the three night. Just to reiterate one more time, and I want you to clarify me or add to it. For me to be considered with Medicare, to be a rehabilitation center, or to, as you're saying, the swing bed that you offer, which not a lot of people do. Once I stay in 3 days, it makes me eligible. So if I'm sent home in 2 days, for most insurance, now we had Karen Schwartz on from Bynum talking about all the subsidiaries that are associated with Medicare. And we've not warned, but we've at least told people that as they turn 65, you're going to get engulfed by a lot of opportunities. So the red, white, and blue card's not the only one as it was maybe 10 years ago. And some, not to say anything about their policy being good, bad, or indifferent, don't require, but for the most part, you're going to need to stay in that facility for 3 days. And it sounds like what the swing bed gives you is one more option, which might be the best.
That's right, Jeff. It is one more option for those patients, like as we said earlier, that need a little more skilled nursing care, and in addition to that, rehab services. Just to get them ready to go back home so they can function independent.
You know what's nice about that is, we always use a hip because we see so many times someone breaks their hip. And unfortunately, I think Dr. Marr always points out what will happen. And 25% of them happen about one of those 4 times, and 25% you die. There's just something where the body breaks down. You don't get your exercise. You lose your motivation, especially once we hit 80s into the 90s. And this sounds like it's an option. And where I guess I was going with it, it'd be nice to be able to stay in one place beyond 3 days rather than I pack up, I go somewhere for another 15 to 20 days, depending on my insurance and my ability to rehabilitate. And then I got to go back somewhere else. They get a stay, or they come to you from another facility, as you mentioned, and can stay for a couple of weeks.
You're right in that sometimes, I believe you said 25% of the times, it's a life-ending event when you have a hip fracture. And I've seen it personally. What makes the difference is when you come into a facility like ours, into our swing bed unit, we have therapists on hand, we have nursing staff around the clock, and we engage the patient in their healing process. And so we have them on a routine, and that keeps them moving. If you stop, and that's the biggest danger, is stopping. And that's what we avoid on a swing bed unit.
We have a wonderful activities coordinator, Stacy Mosier, and we have people that cry when they leave because they don't want to leave. They've had such a good time, and they want to move in. So I think that's a testament to how she cares about everybody up there.
And your hospitalist will also be there as well. So a continuum of care continues more than just the 3 days. It's through the duration. And how many hospitalists now is Clarendon touting? And let's speak to that a little bit.
We have 4 hospitalists full-time as well as 2 physician assistants, and we have some part-time people that help us out. Our hospitalist program has actually grown since we've been there. For those of you that don't really know what a hospitalist program is, over the last decade or so, with all the new regulations and all, it's been very hard for providers to be in the office and be in the hospital. And so what hospitalists do is we're sort of a continuation of your outpatient care in the hospital. So we take care of you while you're admitted, and then we try to get you back to your regular physician.
Katie, I want you to, because we're coming up on a short break here, and I think that's very important to talk to people about hospitalists. And as we come back on our next segment, I'd like for you to follow up on that, and we'll be right back.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we are back. Medical Forum, again, thank you for listening in. And again, if you want to re-catch some of the show or catch the whole show, we do re-air on Sunday from 2 to 3. And want to put a shout out to the Alzheimer's Association. We had a guest on a couple weeks ago, Sam Wiley and Elizabeth Brantley. They just do a heck of a job. Tough situation. Support them in any way you can, but also if you're dealing with an Alzheimer patient, whether you're the caregiver or it's something that a neighbor across the street or what have you, there are so many opportunities out there to get help from associations. There's one on Thursday nights, the first Thursday at McElveen Manor. The Alzheimer is from 6 to 8. You can give Cheryl Fluharty a call. She heads that up for the Alzheimer's Association. You can reach her at 905-7720. It's a great organization, great people, and they have great resources. Today, we'll get back with Clarendon Health Systems, and what we left, Dr. Rabon, Katie Rabon was talking to us about the hospitalist and kind of what's been a changing trend through the years. Yet I think people need to understand how valuable the hospitalists are and how they work in such conjunction with your regular physician as you have your stay in the hospital.
Right. So The hospitalist actually, it should be a seamless transition, and it's almost a specialty within itself. There's a difference between outpatient medicine and inpatient medicine, and so when you come in the hospital, your primary care doctor can be in the office and doesn't get called away for emergencies and can be there when you need them. And then when you're in the hospital, if you're in the ICU or things are going bad, or you need somebody right away, the hospitalists are physically there in the hospital 24/7. So, they're more readily accessible, and we can make sure that we get a copy of the records back to your primary care doctor so that they know what's been going on, so that everybody's sort of in the loop.
So it's a good win-win, and I know that one of the key components with all hospitals now is once we discharge the patient, really would like to see them not have to come back. And I think that's a win for everyone, for the hospitals, for the patient. And I know Medicare's really pressing the hospitals, and I think all hospitals do a fine job of diagnosing and try to treat them, get them back to their regular physician. So part of that equation is seeing their physicians within a 48 hours, and I think that's where your hospitalists do a great job of getting that information back. The primary physician sees them and then gets in and takes over that continuum of care. But I want to switch gears on you. You've been in the headlines a little bit lately. First inpatient hospital in South Carolina. Now, and this is going to be good. So usually when we read that around this neck of the woods, it's not always good. So this is good. I'm always scared to be the first of something.
Well, I thought it was interesting when you started talking to Katie, and I looked at each other like, what is Jeff going to say?
He's getting ready to spring something on us that we didn't know about.
No, I hope you do. I might here. No, to offer mothers nitrous oxide as a form of pain management during labor. And that's kind of
yeah, we're really excited about that. Tom Chappell is one of our midwives, and we have a very robust midwifery program. And a lot of times you see the midwives in patients that want a more natural labor, more natural birth. And, with epidurals and IV medications, nitrous oxide that used to be used years and years ago has not been used as often. And some of the birthing centers will do it, but we are still the only inpatient hospital in South Carolina that's doing it. It's patient controlled, and everybody that has used it has had a positive experience that I'm aware of. We've not had any adverse outcomes or issues, and so we're really excited that we have an alternative, and it just helps ease the labor. So you're not completely zonked out or sedated. You're still involved in the process. Mm-hmm. So I think it's been a great addition, to all the services that we offer.
I think, Jeff, along those same lines as I indicated earlier, the very first patient that elected to receive nitric oxide was a lady given from Sumter County. And, so it was, when I talked with her the next day, she was really glad that we had that service available. And I really want to thank Tom Chappell for spearheading that initiative and getting that service available in Clarendon.
And most of the ladies that have used it, they say it just takes the edge off.
Right.
Which I think is really something, having gone through labor. I think that's great to be able to offer
I
that.
have 2 children, and there is that threshold part where the epidural, it's too late.
Right.
And for the young people listening out there, when you say, I'm going to tough it out, and then all of a sudden it gets tough, and they're like, bring me the epidural. We've gone past that.
Yeah, there is a point of no return.
And so maybe this is...
We've actually had that happen.
Yeah. One other thing in our OB area, we're doing something called centering now. And I'm not sure if you're familiar with that program or not, but we're really excited about that. It's a new way to offer perinatal care to expectant mothers. It promotes education and support in a group setting. I know a lot of times when you get mothers that are sort of on that same schedule of coming every month or every 2 weeks, they kind of get to know each other out in the waiting room. Mm-hmm. And this actually puts it in a more formal setting. And you still have your individual time with the obstetrician or the midwife, but you also have the support of other people that are sort of going through it at the same time, and you can ask questions, having a leader of the group there. Some of the studies have shown that it really, which I was surprised, but it decreases preterm labor as well as improves birth weights. So we're really excited about that. We've got our first group going through now and are having very positive results.
Super. Well, as we come up, we got about a minute and a half on this, and we might as well. The elephant in the room with every hospital seems to me is the people that use the emergency room in lieu of their physicians and all that. And I know it's a tough job, and it's a tough service. Talk to us about Clarendon 24/7 emergency room nonprofit. How do we keep this thing going, Richard, with all the hurdles involved?
Well, this year, Jeff, just to give you some type of indication, Clarendon is going to spend in dollars $6.7 million in uncompensated care, and a lot of that is driven through the emergency room. So as all hospitals, we have issues with people utilizing the emergency department inappropriately.
Mm-hmm.
However, as most physician practices, there are small businesses, and they have to collect their copays and get paid for the visit. Some of these people would prefer to come and wait in the emergency room for 3 or 4 hours versus paying their primary care doctor. So in essence, the emergency department becomes the de facto primary care center, and so it is an issue that all hospitals that we struggle with.
It is tough, and I'm sure being on 95, you get a lot of people. If I feel like I'm having chest pain and I'm driving back to Boston and on the way through 95, here's the nearest hospital. So I'm sure you get maybe more than other.
We get our fair number of out-of-state visitors to our hospital.
Cool.
They are always very, very appreciative.
That's great. Well, we're coming up on our last segment. Again, I want to thank our sponsor, At Your Service Home Care, your concierge, your guide to home care and beyond. Give them a call, 607-9677, and we'll be back with our last segment.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
This is Brooke Luce, admission instructor with Sumter East Health and Rehabilitation. Our primary location is at 975 Miller Road in Sumter. We offer short-term rehab and long-term care. Our specialty physicians and rehab team will work in partnership with your physician to design a rehab program geared towards your specific needs, including chronic weakness, reducing pain, chronic wounds, stroke rehab, and much more. For more information, please call Brooke Luce at 803-840-7515.
Reliable medical equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnston with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
We're back on this Saturday morning. I want to thank our guest for a very educating everyone here on Clarendon Memorial on all that's going on. Anyone who reads the newspaper or has been down to Clarendon sees the things on the peripheral. But now I think we're getting a real good judge of the people behind the scenes. And when we left, we talked about the emergency room and $6.7 million. You guys are going to take punch in the chin, basically. Back to the community. That's saying, no, we're here. We understand. We've got guests that come through here that travel from here to Florida to New York and such. And, when they come in, we take all, we'd love for them to pay their copay. We'd love for them to have insurance. But we kind of just understand that that's kind of what happens with an ER. That's it. Mm-hmm. Infusion Center. Talk to us about the infusion.
The Infusion Center was established within the last couple of years as well. It's an alternative to coming in the hospital. Sometimes if you're sick and you might need some IV fluid, you might need some IV antibiotics, you may even need a blood transfusion. But it's more of either an acute problem that you're not sick enough to come in the hospital, or a chronic problem where you just need a little bit of extra. We have people that come in for fluids that have had cancer, that get dehydrated pretty easily, and so it's open Monday through Friday, from 9 to 5. It's located on the second floor of the hospital, from your pop, and we'll give different medications, whether it's antibiotics, give the blood, anything that we can do in that outpatient setting. And sometimes we do make arrangements if it's something that needs to be continued for 7 days, 10 days. We make arrangements over the weekend to have it covered as well in another location of the hospital. There's a certified registered nurse that is there. And we're really excited. And I think it's added a lot to our hospital.
Katie, tell us about something else that give us one more. Time is always of essence. Time flies by, which is great in some respect. Tell us one more, because then I want to get with Richard on your leapfrog. I think you want to brag about a little bit. Which is tremendous.
Well, we have the Clarendon Clinic that has opened up recently, and it's right now open Monday through Friday from 10 to 6. However, October 1st, we'll be offering extended hours. And so this is our answer to our primary care practices and our patients that maybe aren't sick enough to come in the ER, and they don't want to be part of that burden in the emergency room, but yet they need to be seen. They might have strep throat. They might have been in the lake and cut their foot on a shell and need stitches. So it'll be open 8 to 8 Monday through Friday, and 10 to 6 Saturdays and Sundays. So we're really excited about that. We have 2 nurse practitioners as well as a physician that will be staffing.
Very good. It was documented in the newspaper. We alluded to this, Richard. The Leapfrog survey, which is, I believe this is multiple government agencies that they measure the care. I think there's a tremendous amount, well beyond what I know.
That's right.
Inform us on that, because I know that's right up your alley as a CEO.
Well, the Leapfrog organization is a industry trade group organization sponsored by an industry to monitor healthcare services provided to their client businesses. So that's how Leapfrog sort of started. In our case, we unfortunately the first year we participated in the Leapfrog survey, we didn't exactly fill the entire form out, so we received a very challenging score.
Okay.
And so since that time, starting roughly 2.5 years ago, we've made a concerted effort to actually document what we do, to document the quality of care that we provide to our patients. And from that time, we have moved up the scale. The last Leapfrog score we received was a B, which was on par with all the hospitals generally in this area. So in small, rural Clarendon County, the quality of care you receive at our facility is equivalent to the care you'll receive in Columbia or Charleston or Florence. So we're very happy about our score. It is a never-ending process that as we try to improve what we do.
That's great, and that covers so many things. If I was a patient in your hospital, do I participate in that through questionnaires? Do they call people? Is it something that people fill out surveys? How do we get a B or an A or a poor score?
Well, quality scores obviously from CMS is one of the components. And we submit those on a quarterly basis to Medicare. Our patient satisfaction surveys is a component of that. And then there's unique questions and unique qualifiers through Leapfrog that we have to answer with additional data, and that's how we arrive at our score. Now, I can confused that just a second ago with DNV, which is our accrediting organization, which a lot of people have heard the term Joint Commission to come in and accredit the hospital. We switched from Joint Commission to DNV, 3 years ago. 3 years. And, DNV is an annual survey. Joint Commission is every 3 years.
Right.
So we felt like as an organization, we could drive fundamental day-to-day change through an annual survey versus a every 3 year survey. And that was one of the primary reasons why we made that switch.
That's a tough call because we have to do that in medical equipment. And if I went in and talked to my general manager and said that we're going to do it every year, I think I would probably be a patient of Clarendon Memorial, or because my head would have been cut off. So this is to be able to do that and take that challenge on. That's daunting.
Well, Jeff, and I understand what you're saying. It was a difficult decision when we made it. But my point I was trying to drive to the organization is we will be a top quality organization, and in order to do that, there are these things we have to do consistently.
Yeah.
Not to ramp up for a survey, but every day.
Yeah, and put you on the clock every year, right?
Every
so it's
year.
not because I don't care who you are. When I tell you where you're going to have a test on something 3 years from now, not too many people are giving it much consideration until we get on the cusp of that 3 years. So that keeps everyone on the same page. We're always on duty.
We're always on.
That's great. We've got about a minute left, Katie. Recap. It sounds like the administration with the physicians coming in. From cardiopulmonology to the emergency room to the pain management clinic with the mothers, with the 4 hospitalists coming in, the swing bed unit. Do you sleep?
Oh.
Do you? Have you slept in 2 years? Just feeling.
I'll have to. I'm not going to answer that one, Jeff. But I know one thing I want to say, and we've left them out, is home health. Home health is a vital part. And you mentioned about trying to help people stay out of the hospital. And I think our home health with their nursing, therapists, aides, they're really
fantastic.
They are. Yeah. So I do have to say Denise Melton is our director of home health, and she does a fantastic job with our home health.
She does. Richard, we got about 10 seconds left. Give us some contact points and
I
finish
really
up for us.
I really want to thank the medical staff at Clarendon Memorial, the administrative staff at Clarendon, and our board at Clarendon. Because it takes all 3 entities within the organization to align the organization to move forward. We have a great medical staff.
Awesome. Thank you all for coming in on Saturday. All right. Good luck to you.
Thank you, Jeff.